Secondly, we have the other procedure called as pericardial window. Here, the doctor is going to excise a portion of the pericardial sac, and this is commonly done for infectious conditions of the pericardium, namely pericarditis. Next thing, what we are going to see is pericardiostomy. Here, an artificial opening is going to be created in the pericardium, and thereby there can be a continuous drainage of the pericardial fluid. Okay. So next, we are going to see cardiac tumor. So tumors also form in the heart. Whether it is an intracardiac tumor or an external cardiac tumor, depending on that, we have separate code sets. Commonly, across this entire cardiovascular system, and of course in the anesthesia section as well, we come across a particular procedure called as a CPB, meaning Cardio-Pulmonary Bypass. What do you mean by that? Whenever you say a bypass, that means you are trying to avoid it. Commonly we would say, hey, how could you bypass a team leader and straight away go to the manager? That means you just avoided the team leader and went to the manager. Same way, a bypass meaning trying to avoid, a shunt kind of, right? When we say a cardiopulmonary bypass, here what happens is the surgery is being taken or the surgery is being conducted avoiding the heart and the lung. That means then how do you think that the person can survive when the heart and the lung does not function? So at that time we resort to a machine called as the heart-lung machine, which actually does the work of the heart and lung. So whenever they institute a bypass, they will employ a machine called as the heart-lung machine. Okay, so these are the sections that is being covered as an initial part of our CPT coding manual.